So hello friends, so today I am going to continue the remaining part of anemia. So today I am going to explain or I am going to teach that is iron deficiency anemia. So first of all that is I am to say that here that hemoglobin chain that that is made up of heme and globin, and this heme contains iron and protoporphyrin 9, that is heme is made up of iron and protoporphyrin 9. So therefore you can see here that is iron is essential for the hemoglobin synthesis. So this is a normal, or you can say here basically normal physiological hemoglobin synthesis. But now I am going to say some abnormal. So here that you can see here that due to a disease or due to a problem no iron has been taken. Yes, it can be a region like due to pregnancy also it increases, or that is in diet there is deficiency of iron. So therefore no iron, that means no or less hemoglobin synthesis. As hemoglobin chain synthesis reduce, automatically hemoglobin synthesis reduce. So therefore that is if hemoglobin synthesis reduce, then automatically RBC production reduce, or then IDA iron deficiency anemia develops, or due to less hemoglobin synthesis also iron deficiency anemia develops. So here due to less hemoglobin synthesis also you can see iron deficiency anemia develops. So now I am going to explain you here basically what are the symptoms and condition. So now you can see here that this is the normal. So here RBC, and that is a normal RBC shape is biconcave. So here that it is a biconcave and hemoglobin is present at the center. But here also it is a RBC shape in case of iron deficiency anemia. So you can see here that is the as compared to the normal RBC size is reduced, and the amount of hemoglobin has also been reduced. So therefore that is I have written that in iron deficiency anemia that is RBC is microcytic, that means its size is reduced and hemoglobin content is less. Now so here that you should know that here that is why fatigue occurs in iron deficiency anemia, and this fatigue here occurs in all anemia, not in case of iron deficiency anemia, in all anemia. So first of all that I am teaching you here abnormal. So first you should know the normal physiologies or a normal condition, that that RBC supplies oxygen to tissues, because this concept you have been studying since class 7. And then this RBC supplies oxygen to tissues, and this oxygen used by tissues for energy generation. And I think you know the equation also. If you don't know, I am going to show you the. So here this is the equation that you should know here, that is glucose utilized or is oxidized. So here glucose and oxygen react. So here this leads to the generation of carbon dioxide, water and energy. And I think that this reaction you also study in the respiration in plants during your NEET UG journey also. So here in this way, here energy created. So here that this is all about normal. So therefore that in case of anemia, so here that RBC synthesis or hemoglobin synthesis reduced. So therefore now you can see here that therefore if less RBC, then automatic less oxygen supplied to tissues. So therefore less energy generation, and due to less energy generation fatigue or weakness occurs. So now that is I am going to here explain you that is why spoon-shaped nails and pale are found in iron deficiency anemia. So here basically spoon-shaped nails. So here chylomicrons. So here due to iron deficiency anemia, and pale due to low oxygen availability. So friends, you can see here that it is about spoon-shaped nails. You can see. So here normal. And if you want to know that in case of normal also, so here basically that is in normal nail. So here you can see here basically the angle. So here between, that this angle should be an obtuse angle, but in case of here spoon shaped nail, that this angle is reduced. So here basically that is nail beds. So that is nail beds is like this way, that it becomes like a spoon. So therefore that is, it becomes like a spoon, so therefore it is known as, so here spoon shaped nails, or here basically koilonychia. And here also pallor found in the lower palpebral conjunctiva, and this pallor also due to low oxygen availability. So here basically now I think you can read. So here there is iron deficiency anemia, that here it is the importance of iron in the hemoglobin synthesis, and here basically, and this here basically when iron deficient in the body, so as I explained, erythropoiesis reduces and iron deficiency anemia develops. So here also I explained, so here basically that this part also basically no iron, that means no or less hemoglobin synthesis, iron deficiency anemia develops. And also that here that now this is a part that in iron deficiency anemia, so here the RBC is microcytic and with low hemoglobin. So here and this part I covered that in iron deficiency anemia, RBC is microcytic and hemoglobin content is less. So also now here symptoms are e.g. fatigability. So here also you can see here basically why fatigue occurs in iron deficiency anemia. And also now I am going to explain basically why there is children with iron deficiency anemia that is so impaired. So now so this is a concept of biochemistry also, that is in biochemistry you will have to study also this portion, that here that you can see here that is through tyrosine metabolism, that is hormones like thyroid hormones, T3, T4, melanin, dopamine, epinephrine, all these hormones are produced. But here there is one thing, that for tyrosine metabolism there is iron required. So you can, so now you know that if there is no iron, that means that is our tyrosine metabolism will be affected. So therefore that is I written that in iron deficiency anemia, that is there is no iron, that means no iron, that means no tyrosine metabolism, and here that means you can see here no synthesis of T3 and T4. Now that is I am going to explain you the importance of T3 and T4, that here T3 and T4 required for brain function and excitation. This is the most important. So but here you can see here that already I have discussed that in iron deficiency anemia T3 and T4 synthesis doesn't occur. So therefore it is brain function and CNS excitation affected. So therefore children with IDA have poor performance. So therefore also this is the second part, that is you can see here but children with iron deficiency anemia, that is also so impaired growth as well as and poor scholastic development and performance. And also symptoms, that is pallor you have seen, and here spoon shaped nails and a glossy tongue also develop, and this is a treatment also, that is you can study, that is iron. So now I am going to explain you about hemolytic anemia. So therefore that hemolytic anemia occurs due to abnormality in the shape of RBCs, and here and this leads to excess damage of RBC. So therefore, so here basically excess RBC damage, and this excess RBC damage leads to anemia. So therefore now so before understanding this, just little introduction that about a normal shape of RBC, that you can see here that it is a simple biconcave disc with hemoglobin present at the center. Now so first abnormality I am going to explain about the hereditary spherocytosis. So it is a genetic also. So here you can see here that as compared to normal, that is the size is reduced, and here and the size is small and spherical. So here this is about the hereditary spherocytosis. And also that is you should know that this RBC, that is when their 120 lifespan has been covered, then this RBC on passing through spleen they are destroyed, and on destroyed they are converted to bilirubin. And here and this concept also you have to study in your biochemistry also. But here you can see here that is when this RBC that is passes through spleen, or that is splenic pulp. And here the diagram of splenic pulp is like this. So here this is about a splenic pulp, and here you can see here that in this splenic pulp these are the basically pulps, and this is a histology of spleen also. You will study this in anatomy also. And when this so here small and spherical RBC passes through spleen, then it is ruptured. So here excessive destruction also leads to hemolytic anemia. Now about sickle cell anemia. So therefore that sickle cell anemia, that is so your disease the hemoglobin found in sickle cell anemia, that is RBC found in sickle cell anemia, that is in this case, so here that is HbS hemoglobin found in sickle cell anemia. So here basically I think you studied this about also in a NEET UG journey also. So here basically the normal situation you can see here. This is so first of all, you know that adult hemoglobin has alpha 2 and beta globin chains. So therefore that is in the beta globin chain of hemoglobin. So here normally glutamate present at 6th position, but here that is in case of this disease that glutamate at 6th position is replaced by valine, and here and this leads to, so here basically abnormal condition, so here sickle cell anemia. And when this, so here basically RBC that is exposed then to RBC or spleen, then here exposed to that is hemoglobin or blood, so then automatically they are converted to sickle cell shape, and on being converted to sickle cell shape, so here that is their destruction or here damage is too large or too long, so therefore sickle cell anemia develops. Now here it is a case of erythroblastosis fetalis. I think you studied about this also. So now so this is a case. So here you can see here that in case erythroblastosis fetalis, so here you can see here that this is the, so here RBC of fetus, and here fetus is Rh positive, whereas that this so here antibodies produced by this Rh negative mother, and these antibodies come and destroy this RBC. So friends, so now I'm going to explain you about the hemolytic anemia. So you can see here that different abnormalities, hereditary, so they rupture easily as they go through the capillaries, especially through the spleen. So therefore, as I mentioned, so therefore excessive RBC destruction. So first of all, that you can see here that is in heterospherocytosis, RBC cells are small, rather biconcave, and also that one thing you can see here basically as their biconcave structure is not maintained, so therefore that is they can't, so here basically withstand excessive forces, and here and it's a main important that is on passing through the spleen, so here they're easily ruptured. Now here about a sickle cell anemia. So here basically sickle cell anemia, so here basically hemoglobin S is present, and here and this so here hemoglobin exposed to low concentration of oxygen precipitates inside, and these crystals give the appearance of sickle cell rather than biconcave disc, as I mentioned here. So here basically sickle shape, so here no biconcave disc, so here sickle shape, and the normal is biconcave disc, and the precipitate hemoglobin so damages the cell membrane, so the cell becomes highly fragile, leading to serious anemia. And also, and the last part about erythroblastosis fetalis, so here basically Rh positive red blood cells in a fetus attacked by antibodies from an Rh negative mother, and these antibodies make the Rh positive cells fragile, leading to a rapid rupture and causing the child to be born with serious anemia. So now the last part, effects of anemia of the circulatory system. So friends, that effects of anemia on circulation, but please tell me, that is one question, that is what do you think, does heartbeat increase or decrease in anemia? So for 1 minute or like 2 minutes, you please pause the video and think, and then come to the solution. Okay, now so before understanding or before the answer, that is I want to tell you in the regulation of erythropoiesis that I mentioned about hypoxia. What is hypoxia? Decreased availability of oxygen to tissues of body. So I think that you remember this. So here hypoxia definition. Earlier also in any anemia, so here that due to less RBC synthesis and due to less oxygen supply to tissues, less energy generation. So I think that by seeing this, that less oxygen supply to tissues, and by seeing this definition, In this definition, that is decreased availability of oxygen to tissues, that I think that you are able to guess the answer. Yes. So first of all, that you should know that in this case, so here basically hypoxia develops, and due to hypoxia also, so first of all, that is heartbeat increases. Now I am going to explain you how. So first of all, that less RBC, that means less oxygen supplied to tissues, hypoxia, and this hypoxia stimulates heart to increase oxygen supply. That is written in your friends. I know that you may not about to understand cardiac output, but about this cardiac output you will study in cardiac physiology also. But just remember, heartbeat is directly proportional to cardiac output. At present, just remember this. And about cardiac output, that is about the regulation, and here what are factors stimulating cardiac output, I am going to study in cardiac physiology also. So now I think that you are able to understand that. Yes, sir. So this decreases the blood flow in the peripheral. So far then a greater normal quantities of blood flow to the capillary center. Hypoxia. So therefore hypoxia resulting from diminished or the reduced blood supply. So therefore that this causes a further, that is increase in return of blood to the heart and increasing cardiac output. And here that is all these things, basically cardiac output as well as pumping workload of the heart increased. So this is the effects of anemia on the circulatory system. So that's all about anemia. So now in a very and in the revision of one day, that is I am going to explain that this chart also completely.